Hello and welcome to the week. This is Pooja, and today we are talking about monkeypox. With cases of monkeypox being reported from across the world and a subsequent alert by WHO, the World Health Organization, the central government's Ministry of Health has directed premier health institutes like National Center for Disease Control and ICMR to monitor the situation in the country. On Sunday, that is day before yesterday, a high-level meeting was held to review the preparedness of laboratories across the country to test likely cases of Mpox, that is monkeypox, in view of its declaration as a public health emergency by the World Health Organization recently.
After COVID, this is probably the second time this kind of an announcement is coming. This, however, does not mean that Mpox has already become a pandemic or it is spreading around the world the way COVID did at that time. The transmissibility of this disease is much less compared to what we had seen in COVID. The transmission of Mpox is through close contact, which might include respiratory, because the new strain which has been found in the countries outside the regular African countries, especially Congo, Kenya, Uganda, and now in Sweden, is something called as clade 1b, which has higher transmissibility and can spread through respiratory route. So that is definitely there. So transmission has been higher, and we know that it has affected more of children and it has caused more of deaths. In spite of that, it is nowhere comparable to COVID in terms of its spread or transmission, and we hope that we will be able to limit it to a small numbers in whichever country we see. However, this warning from the WHO or the statement from WHO as a public health emergency warrants a couple of steps which all of us, including government and community, need to take.
The airports are already on a high alert for any symptomatic flyers from the affected countries. Dr. Subhash Hira, professor of global health at the University of Washington, reportedly said that while cases of monkeypox have not been reported in India yet, the country has a large number of international flyers coming from Africa and Europe on an average daily, and the health staff screening travelers at the airports are not trained to identify mpox rashes through physical checks. In the 1980s, very interestingly, when he used to clinically examine cases of monkeypox in Zambia and Africa, Dr. Hira said that they rarely required any hospitalization, the patients over there, because most of the population then was already vaccinated for smallpox virus. But then the smallpox vaccine global campaign ended in 1980, and for many years after that, monkeypox transmission from Africa to other continents was not reported due to smallpox vaccine protection. But now, the populations before the age of 40 globally may not have received the smallpox vaccination, says the doctor. This is a mutating monkeypox virus that is transmitting from man to man, from monkey meat handlers to general populations, and becoming a faster transmitting virus among adults. Interestingly, the symptoms of monkeypox are much milder than the symptoms of smallpox, even though there is a lot of similarity between the two. The time taken from catching the infection to it transforming into symptoms is usually 7 to 14 days in case of monkeypox. The illness begins with fever and chills and headaches and swollen lymph nodes. Within the next 3 to 4 days, rashes appear which spread all over the body. So these also affect the face, the hands, and the feet. Lesions progress through various stages before falling off as scabs. The illness lasts from 2 to 4 weeks, and so experts advise avoiding close contact with droplets from infected humans and prolonged face to face contact.